Okay, follow me here. Posterior, root, anterior. We get to the joining. I formed a spinal nerve exits. Is everybody with me? Now, the little pieces that are branching, my rami and the meningeal branch. All right? I had a posterior ramus. I've got an anterior ramus. Now, that one's going to get a little difficult, but just kind of hang with it, okay? That one going right here, coming off of this anterior portion. And then the meningeal, which is going to turn around. Do they have it? Yes, they've got it right here. The meningeal turns around and goes back in. Basically goes back in to areas that are going to feed the meninges. That's the view that you get in a section. There it is if you get to dissect cadaver. Have you ever thought about your spinal cord? Thing's tough. It really is. I mean, look at that. And it would take a lot to cut through that. Definitely would. And then, of course, the little rootlets that are coming off and branching into the spinal nerves. That's pretty cool. So these little rami that we're going to see, like we said, when we have those rami, one of the biggest things about the rami, well, they're all important, but in that thoracic region, the importance of those intercostal muscles. All right? Because that is going to come into play when we talk about the respiratory system. They are extremely important, where we're going to see these little branchings that occur, and they go to those intercostal muscles. Now, on the anterior portion, where these little rami are doing this number, man, that looks a little more difficult. This one on the anterior side, and then see this right here, the sympathetic chain ganglion. That's going to come into play with our autonomic nervous system. What do you think of if you hear autonomic nervous system?
Automatic.
Do what?
Automatic.
Automatic. Whew, that one's going to get fun. So the plexuses, we have a cervical, brachial, lumbar, sacral, coccygeal. So you're going to have this huge grouping. Some of them have some very important nerves. In the cervical plexus, where we get the supply to the neck, we're going to have something else that comes from that plexus, and it's termed the phrenic nerve. This one innervates the diaphragm. What's the function of the diaphragm? Breathing. Ever thought about your diaphragm? You will after we do the respiratory system. In the brachial plexus, anybody in here ever had carpal tunnel syndrome? Not a whole lot of fun. The sacral plexus, lumbar plexus, that can definitely make the legs and so forth hurt. Coccygeal. Anybody ever broke their coccyx bone? That's not a lot of fun either. Ooh. The plexuses, just like before, the nerves are mixed. They're carrying information in and information out. When we look in areas such as muscles, tendons, and joints, that's where you're going to find specialized cells that help with proprioception, that help us with our place in space. Motor function. Now, yes, a lot of it is to stimulate muscle contraction, but we have to remember how many different types of muscle we have. Not just the skeletal muscle, but also the smooth muscle and, yes, cardiac. However, the heart does not depend on our nervous system to function. Do we affect it? Yes. But the heart is totally operating on its own. It has its own mechanical system altogether. So for the rest of the chapter, for chapter 13, it's basically walking you through pictures of the plexuses that exist and the different nerves that are present. A lot of them, you're going to, depending on what type of field you go into, some of them are going to become very familiar to you because they're going to be the nerves that are a little more commonly aggravated and hurt. Okay? Now, if you get into your field and you get into deeper muscles, okay, you're going to hit kind of different nerves, you know, that are leading to that. But whatever field you choose to go into, you're probably going to see some that are a little more common than others. This is a good example of how thick these plexi are in looking at a cadaver and how thick and tough those nerves actually are. So they're much tougher than what we think of. Goes into the lumbar plexus, one that a lot of people have damage to, especially when you get into the sciatic nerve. Okay? That sciatic nerve is a definite problem for a lot of people. The coccygeal, a lot of times, like giving birth could, for example, break the coccyx bone, depending on how big the baby might be. Okay? A simple fall, like if you just are walking or roller skating or running or whatever, that you fall just right, break that coccyx bone, have to walk around with that little donut to sit on for about 6 weeks. Just saying. Nerve injuries, they're pretty common. When we look at ones that are very common, for example, the radial nerve, that'll be one that's kind of common. Now, this one from the cervical the brachial plexus passes through axilla. Any idea what those might be? Our armpits. It's usually one of the things that happens, people who don't use crutches correctly, because, you know, a lot of times people think crutches are supposed to just be buried right up in, you know, underneath your armpits and everything. Not necessarily, okay? You need a little bit of blood flow to get through there, and it can actually lead to crutch paralysis if people use their crutches wrong. Wrist drop is another one. It'll be like you go to pick something up and it's like, The sciatica, a lot of it is due to a herniated disc. If you ever heard somebody say I got a herniated disc, that means the little disc in between is split. It's kind of like pushing out through the bones, and yeah, it is painful. Here's our dermatomes. This is very important in helping to identify what nerve might be damaged. Because if they come in complaining, okay, well, maybe I hurt here, or I hurt there, or I hurt up here, it can help lead the doctor to that area of the spinal nerves and maybe help create a diagnosis for the pain. Reflexes, now, that's something that I've mentioned quite a few times. Reflexes, These are quick, they're involuntary, and they're stereotyped, meaning they're going to be the same for the most part, no matter what. Think about the doctor hitting your knee and your foot kicks out, okay? That's going to be, unless something's wrong, the same for everybody. The thing about a reflex, the response occurs at the level of the spinal cord where the body is being hit. So if you're thinking about something that might happen with the lower body, it's going to occur in L and S, okay? If something happens up in the upper body, that's going to be the C and the T regions. But the information is actually processed at the level of the spinal cord. It doesn't have to be a response from the brain, which is kind of cool. Take a break, be back at 9:30.